Hi, everybody. Welcome back to The Pathway. My name is Taylor Hennrick. I'm joined here by Sarang Patel.
Hey, guys.
Hey, so we're excited today. We're going to be talking about seasonal affective disorder. And usually, this is a topic that might be more closely linked to the wintertime or different seasonal changes. Today, we hope to be able to dive in and talk a little bit more about how seasonal affective disorder can affect us in the summertime.
Let's get it.
So as we go into things today, the primary thing that I'd like to talk about is the adage of, hey, it's getting nicer outside. I can spend more time outside. I'm getting outside of the house. There's more greenery. Hopefully there's more activities, more to do, more engagement, especially here in Michigan. Why don't I feel better? That's the crux of it.
Good question.
I have a good number of clients that maintained on appropriate medications, maintained in appropriate modalities, active in therapy, doing their thing with their medications, doing all the things that they're supposed to do.
Right.
Proper sleep hygiene, eating, hydrating appropriately, attending social events, keeping in touch with family, etc. And the question still comes up like, I don't feel better.
Right.
It's not reflected on PHQ-9. We're not seeing any improvement with their medications. They're not subjectively reporting that they feel better. What do we do? What are our next steps?
Yeah, I think valid point. And I think it's something that maybe we overlooked initially when we were first thinking about topics to kind of talk about. But now being that the summer months, I think you see a lot more than you did, right? Obviously, with it being summer, you hope that it's almost like you hope that the switch flips, where it goes from winter months where it's gloomier, when it's sunnier now, you say, oh, if you just feel better. Unfortunately, it is not like that for a lot of people. I think you and I were talking about it earlier. I would say that it's the same question that you have to ask people, right? When they say, well, is this that I'm just going to, do I actually feel better? I'm just not really realizing it? Or is it that I'm not actually doing better at all?
That's a good point.
And I think you have to ask yourself the same thing we've probably talked about numerous times in this podcast is, do you feel as good as you want to be feeling or just better than you did before? Right? So when you have that question, you're going to the summer months, you're saying the sun's out more. Obviously, we talked about it before. Sleep may change a little bit more as well. What can you do? So what are your options, right? So what do you tell your patients for, hey, it is sunnier. You should technically be feeling better, right? If it is SAD initially, what can you do? What do you do for your patients?
I encourage them to get light exercise. Some of these things are very basic and may seem commonsensical, but let's hit them. Light exercise 3 to 4 days a week, 30 minutes. You don't have to be a marathon runner. Go for a walk the dogs, put your AirPods in, put your headphones in, call somebody. Go walk around the neighborhood, go down by the water, whatever it is. I always encourage people to connect with other people. Make sure you're having at least some social component, some ability to lean on your supports and spend time. Take up some of your interests. If your busy time of work is during the summer, so you're kind of lamenting the fact that it's summer, carve out some time for you. Take some you time, have that anchor, have that thing that you latch onto or incentive to work towards. I feel like maybe call it an error or call it something as a provider. When I have a provider-client working relationship, I feel like I play up the placebo effect. I say in March, hey, we're at the turning point, right? We know in Michigan here, we're lucky to be able to treat in this state. Between Michigan and October, we get pretty darn good weather.
Yeah.
So I play up that. But this conversation centers around somebody who doesn't look forward to that. This isn't their time of year.
It doesn't change it.
Yeah. So what steps can we take? Encourage vitamin D supplementation just like we might the rest of the year. Again, make sure they hydrate appropriately. Make sure they're eating good, healthy, balanced diet. Take up activities. Maybe involve yourself in a new hobby. Give yourself something that you can latch onto or look forward to. And obviously spend some time in the sun as long as it's appropriate medically for that client to do so. Boosting their vitamin C, vitamin D levels, and hopefully giving them a little bit of a boost in their mood.
Yeah. I think you have to find your sweet spot. And sometimes it's challenging because a lot of times I'll say, hey, I think it's important for you to see a therapist more in the summer or more leading up to the summer months if you know that it's not going to be helpful. Some people don't realize they're waiting for the summer to feel better and they don't get there. And they're like, now what?
Yes.
So I think it's important that you have a therapist routinely. That way you're not like trying to play catch up at that point to kind of get an idea. Then you and the therapist kind of work through what works for you, like we've been talking about. Everyone's a little bit more differently. Is it exercise? Is it some sort of activities? Is it volunteer work? Is it working more for some people? Is it working less for some people? Trying to figure out what works in your realm, right? Now, I know you mentioned exercise, I think, which we talk about is obviously helpful. Some people say, well, I have bad knees, or I'm elderly, or I have a physical health issue. I can't run, or I can't walk as much up and down the stairs. Because I used to always say, well, go up and down the stairs 5 times, 10 times a day. Some people can't do that. It's pretty common. So what a lot of my patients have been doing now is, it's hard to find at times as well, but they do have it, just like Schoolcraft College, for instance, stuff like that. Aerobic exercises, get in the pool. There's some new saltwater pools as well to kind of help you. And you get those aerobic classes. It's a group effort as well, so you have to make friends that way, especially if you're a widow or lonely or single, it doesn't matter. And that way you get some sort of camaraderie with your group as well. But also that's physical exercise for yourself.
That's a good point. I want to reverb on this topic a little bit. So we talk about SAD and we talk about seasonal affective. What about for climates? It just came to me. What about clients, not climates, that are dysthymic, right? It's persistent.
Yeah.
It's around the clock. I sometimes will have clients who will say, I'm like, how you been? Are you looking, you enjoying the weather? Are you getting outside just because it's part of the appointment?
Yeah.
And they're like, what do you mean? Like, it's been like rainy. It's been so nasty. And it's like 2 out of the last 30 days have been rainy. And I'm like, man, like it's really easy to latch on to those days that are a little bit gloomy or cold. But I'm like thinking to myself, man, the last month has been beautiful. Like, and it's all about that perspective. It's all about how you frame it or what you look at. So I always encourage them, hey, avoid the recency bias. Look back with me and talk about what have the last 30 days looked like, not the last 36 hours.
Yeah.
Right?
I think if it's really like that, where the numbers are kind of skewed, even if they're not that skewed, but a little skewed, right, for 2 days versus the rest of the month or whatever it is, it's important to journal and then look at that with the client together. Now, again, I understand like I may not be spending as much time with the client during their appointments, but a therapist can do that. We can do that pretty briefly as well to then say, and hopefully help the client realize, like, it's only been 3 or 4 days that the weather's been bad, not the last 10 days total, right? So you look at that glass half empty, not full kind of thing.
Absolutely. Try to cognitively reframe how they view it.
Yeah.
So I think it does take some intensive work this time of year. It's really easy for the clients that do love this time of year and they spend time outside and they're involved in beach volleyball and they love rollerblading and they go on trips. That's wonderful.
Yeah.
Like it definitely gives your moods a boost. There's no doubt about it.
Yeah.
Feeling better, not elevated, but just I'm happy. I'm having more good days than bad days. I feel comfortable. My medication is therapeutic and optimized. I'm good with therapy biweekly with my therapist. I'm feeling good. Hey, no problem. I'll see you towards the end of the summer. Let's keep it moving.
Yeah.
But for those clients that are struggling, we sometimes have to get a little bit creative. As the clinician and working in, again, that provider-client relationship, we have to work a little harder to get them out of that. Is there any other creative tools that you utilize or anything that you do to try to improve your patient's overall aptitude or mood?
So I would say I would recommend at that point, if you've kind of exhausted these or kind of started with these aspects that we talked about so far, I'd recommend a med change or an add-on or adjunctive or a consideration for a med change, right? So whether you're taking one antidepressant or 2 antidepressants, it's then next to see, should we change an antidepressant? Should we change to an atypical medication, antipsychotic medication? Should we adjunct it onto what you're taking right now to kind of see, do we see some improvements? So we're essentially trying to say, you've been on these medications currently, or you're on these medications currently, you've been on these medications in the past, what else do we have that's an option that we could use now to kind of see if we get some improvement? And then on top of that, the question is, you may say, well, historically, I know that in the winter months, I always do rough. Or in the winter months, it's not just depression, anxiety, my kid may struggle with ADD symptoms at that time. Mm-hmm. Do you introduce the medication change currently? Mm-hmm. Or do you say, no, we're going to wait until the school year starts or wait until the winter months start to creep up a little bit more, right? Until fall starts to creep in a little bit more to then say, well, let me see how I feel to make that med change. So you have 2 different avenues, right? 2 roads you take. Do you make a change now? Do you make a change later in expectation that the symptoms could get worse?
Man, you are so smart. Keep going.
You keep talking. Keep saying that kind of stuff.
Man. I am so happy you brought this up. That is a perfect way to look at it.
Yeah.
Is this your opportunity? Okay, so if you look at the seasons as ebbs and flows, right? Someone does super well during the summer, fall, they feel great, and then they start to come down, right? It leads to winter, spring, spring, summer, fall, winter. Spring, summer, fall, winter. So if there is this ebbing and flowing in their moods, does that speak to the medication not being as efficacious as you think? Is that reason enough to explore a medication change or augmentation?
it's at least a consideration to have a discussion about it.
Yes.
It doesn't mean you have to make a change. It doesn't mean you want to make a change as a clinician. It doesn't mean the patient wants to make a change either. But it should always be a conversation. Hey, this is what's available. Do we want to make this change now? Do we want to chill with where we're at for the next month? Do we want to follow up a little bit earlier? Do you want to see how some of these changes could be made by exercising, water intake, sleep schedule changes, all that kind of stuff, and then revamp the process or see what we want to do? But I think a lot of times we get into this routine of just doing this questionnaires, this PHQ-9, this GAD-7. Oh, your scores look pretty good. Great, move on. Your scores look pretty good. Great, move on. Where less of it is saying, hey, okay, your score may look good, but do you really feel like you want to be here? Is this where you want to actually be hovering at? Long term. Through the next 6 months, through the summer months, or 3 months for summer, right? For the next 3 months, do you want to be hovering at the range you're feeling currently? Less about these questionnaires and numbers. Even me personally, I don't really base too much weight on these questionnaires and these numbers here. I obviously ask the questions, but I'm more or less saying, hey, you and I together here, how are you feeling? And if you're cool with maintaining at this level, you're like, hey, this is my optimum level. I'm not saying you're going to be at 110% every single day. No one's like that. We're not machines. But if you're content and you're very happy being at this level, you're like, I'm feeling good. Some days are bad, some days are good, but I'm happy with this. Then we're going to chill here.
Yeah. That's euthymia.
Yeah.
That's where you want your clients to be. You want them to have the appropriate medication on board if it's necessary, but they don't feel the consequences of the medication.
Right.
We want them to be engaging in therapy, increase their mindfulness and feel good about where they're out, and report to us stability.
Yeah.
Feeling good. Like, hey, this is where I need to be. I'm functional in all aspects of my life. I have healthy relationships. I feel good professionally. My kids are doing well, whatever it might be. I just feel good. And that's our goal. If you're not reaching that, or if you're only getting a partial response, it begs the question, during a time like this, when you theoretically could be feeling better, are you missing something? Is something not dialed in? Can we hone in? Can we improve something? Can I dial something? Can I do something to help you?
Yeah.
And I like that that's where the conversation's gone today, because summertime is a good example of that. When you have all 4 seasons like we do in the Midwest, you experience some seasonal affective. We all do. We all get some level of that. I think we already keyed in on this before. I'm not going to beat a dead horse here, but the idea is there's not as much to do theoretically. There's, we have to prepare for that. We have to prepare for less sunlight, shorter days, the winter and the summer solstice are times that we kind of see those peaks, and we have to prepare for that. So like you said, do you plan ahead? If somebody isn't doing well now, is it reason enough to make a change? Say they just got done with their semester, they just got done with their school year, they're going through a job change, and they're just not good enough. Do you dial during the summer and say, hey, let's get you to your peak optimization, or do you wait?
If it's distressful to them currently, then I would say I would dial in now. I would make a med change now. I'd have a conversation now. I'd see what's available now to see what we could do. If it's something where it's like, well, let's just say ADD, for instance, or ADHD, and I've always just categorized that way where it relates only to school, even though it does affect you in your personal life, your work life, your home life as well, then I would argue that it's okay to make a change, obviously, when school comes, but we should make the change now to see if we can tolerate it without side effects. Make sure you feel pretty good with it. Let's get into a routine, taking it at nighttime or in the morning, or is it once a day? Is it twice a day? Is it a long acting? Is it a short acting? There are so many variables that I don't feel like the idea of, and again, if it's not distressful right now, then okay, fine. But if it's noticeable right now still to a certain extent, I don't think it's fair to say, well, wait for the school year to come and then tackle it then, or wait for my work to start again if I'm a teacher, let's just say, for instance, right when the school year comes, and tackle it then, because you may not get control over it as fast as you can or find the right medication the first 1 or 2 times.
Right.
So then you're going to be a semester into it, and now we're coming into Christmas, and you're like, now what do we do? The first semester is gone, and they had bad grades, whatever it may be.
Yep.
You'd like to get them acclimated to a routine, all this kind of flow prior to the school year if you can.
And that way you're not trying to make an adjustment while they're declining.
Yeah.
That's a difficult place for us to be with our clients.
Yeah.
The client's not doing well and having more of an emotional appointment, and you're seeing this gradual or steady decline, and now you have to make a medication change. That's when I, as a clinician, I'm hesitant. I'm nervous for the client. I want them to feel better so badly, but I'm fearful of making a change amidst a decline, amidst an episode. If we can preempt episodes and try to plan ahead with them, we can do more to prevent those negative outcomes.
Yeah. And just like that kind of comes back full circle to what we talked about before, like seeing a client or seeing a patient more frequently.
Yeah.
It's you want to catch them in the beginning of the spiral, not mid-spiral, and definitely not the end of the spiral. So if you can follow up with your patients more frequently, have time available for them, give them the time they need, give them the resources they need, the options of treatment that they may need and catch them early in that spiral, I think you prevent a lot of future changes and a lot of turmoil for that patient.
Absolutely. I want to bring it back to one thing you brought up earlier. I have always been a big advocate for the mood journal, right?
Oh, yeah, you do like that.
I do.
You said a mood box one time, right?
Yeah. It was actually called a SAD box, and a client introduced it to me. It was an SAD, or a SAD box is what they called it. And heading into the winter months, this individual suffered from some seasonal affective disorder. This individual would put items that they knew would bring happiness to them in a box and put it away. And whenever this individual started to experience depressive symptoms or felt like they were going into an episode, but they felt comfortable on their meds, they would pull this out. And this individual had a candle that was like a scent that they really, really liked. They had adult coloring books in there because they loved doing that and knew it would bring them happiness. They put their favorite DVD in there of a movie that they knew would bring them joy, amongst other items. And the idea was such a good idea.
Yeah,
so someone could do something like that for the summer as well, whatever it might be. When it comes to mood journaling, I think it helps us to be introspective and be able to look back on how we've actually been, rather than just guessing or throwing out an estimate. I want to know categorically, how have you been since I saw you last time? And I know that's how therapists want it too. They want to know what's going on so we can dive in. What are the stressors? What are the alleviating factors? What's going well? What's not going well? What are you indifferent about?
Right.
Or did you experience anything? Right?
Yeah. Well said. We should do those SAD boxes. That's a smart idea, actually.
I really like the idea. And it's a nice play on words. The SAD box. And you could custom order. There's a way to do it. You could stick different items in there. I just think it was a really novel idea when they brought it up. I just clung to that. And I've recommended it to other individuals based on how well this client did with that.
Yeah. I wonder if you could portray that onto not portray, whatever the word is, but put that onto other things, right? So if a lot of times I talk about this with every year, even the summer months, right? People's, unfortunately, anniversary of death, right? For a lot of family members or friends, whatever it is. If you make a box of things that show you good memories of that to kind of help celebrate life at that point, right? I think that could be, I don't know if that would be triggering or if that would actually be helpful for some people. Again, person by person basis, but that could be something that could be helpful for them too.
Almost like a support.
Yeah.
During that time, knowing full well the lead up to those negative anniversaries is really hard.
Yeah.
Again, as you always bring up, like widowies or widowers, coming up on the time of loss is just, I mean, the lead up is awful.
Yeah. Nothing fixes that.
Nothing fixes it. And the moment they pass it, it's like a sense of relief, but it's not.
It's not, yeah.
It's like a negative sense of relief because it's over, but it's just such the emotional aftermath of that is difficult. And if you had something that could honor the memory, celebrate the life, that's a cool idea. Yeah. And it's nice to be able to think of ideas like that might be helpful. So I guess going back to the core of our conversation, it's getting nicer out. I don't usually have a rough summer, but for some reason I'm not feeling better. What do I do next? I think we've covered a couple of the ideas, but it's not a concrete answer.
No.
There is no like, hey, go get an IV injection or, go get a banana bag at an IV drip place or, eat healthier. It's not simple.
No.
It's a multifaceted, multi-pronged answer. And again, as we've said numerous times, it's going to be customized. It's going to be different from person to person, age range to age range, socioeconomic status from one to another.
Yeah. I always get examples like whatever your mom used to say, right? Drink more water, eat healthier, try to exercise. It's like I sound like a mom right now, but it's that simple. Try to do all these things if you can do to try to see if you can get better.
Absolutely. And for you, it was like, make sure you get your homework done.
There you go.
Listen, pray to whomever you pray to, those
all
things.
168 of them,
There you go. Yeah. Well, I hope that this was a good journey down the pathway today. This is a topic that I think is important as we enter these summer months, as we spend time amidst the summer. If you're a client or a listener who is in need, who might be struggling with some seasonal affective disorder, but you don't want to bring it up, you're hesitant to talk about it, you feel like you should be doing better than you are, this is your sign to talk about it. Bring it up. Reach out. Schedule an appointment. Do what you need to do to try to get yourself to a place where you feel better all 4 seasons of the year.